Hi, I'm Steve Hamill, Vice President of Policy Advocacy and Communication at global public health organization Vital Strategies. And I'm privileged to be moderating today's discussion around the tobacco epidemic and the changing face of the industry that drives it. We'll be discussing the tobacco industry's influence, the latest efforts to rebrand itself as part of the public health solution to end smoking, all while hooking a new generation. We'll hear from tobacco and public health experts who will discuss strategies for how individuals and businesses can negate these efforts by protecting their platforms and rejecting funding and collaboration with an industry that causes millions of preventable deaths around the world each year. Today's panel has been put together by the Truth Initiative, a public health organization dedicated to inspiring tobacco-free lives and achieving culture where all people reject smoking, vaping, and nicotine. I'm thrilled to start today's conversation with Robin Koval, Truth Initiative's CEO and President. Welcome, Robin.
Thank you, Stephen. I'm really happy to have this opportunity today for this important conversation. You know, a hallmark of our Truth Initiative Impact series has always been about giving people the facts so that they can make informed decisions about tobacco products and the tobacco industry. And that's exactly what we're here to do today. So thank you. I'm really looking forward to it.
Me too. I wanted you to set the stage a little bit about this moment in time. I know when Vital Strategies started working in tobacco control around 15 years ago, we seemed to have several big wins and significant momentum as a movement. The Framework Convention on Tobacco Control, the Global Public Health Treaty had recently come into force. And in the US, Truth Initiative has decades of groundbreaking work empowering youth and exposing the tobacco industry. And we've certainly made a lot of gains over the last decade. Now, 2/3 of the world are covered by at least one protective policy. And here in the US, smoking rates have fallen to new lows. But at the same time, tobacco use still remains the leading cause of preventable death in the US and globally. And vaping has emerged as a new threat to young people. The CDC data shows that almost 20% of high school students and nearly 5% of middle school students currently use e-cigarettes, with nearly 40% of high school students doing so on 20 or more of the past 30 days. And in the past few years, particularly, despite our successes, it feels like we're pushing harder than ever. And this fight feels like it's changed, it's different. And why do you think that is? Is our momentum at risk? And how is the industry different? How's the industry different than 10 years ago?
Well, thanks, Stephen. That's a great question. Actually, in many ways, the industry is using the same playbook it always has, deflecting blame for the epidemic, protecting their markets and profits, whenever possible, obstructing or delaying proven effective policies and regulatory or legislative actions, and basically, deceiving the public about the harms of their products. I always think it's important to remember that the inventors of this playbook include companies like Philip Morris and R.J. Reynolds, Altria, who were found by a federal court to be racketeers. In fact, the judge wrote, these are her words, not only were these companies had committed fraud, but they were likely to continue to do so in the future. But I think what is different now is, in many ways, the industry has come out from behind the shadows, is bolder, have amped up their efforts to improve their public image. A lot of that is in response to, an existential threat to their business. Obviously, smoking rates continue to fall. Attempting to use harm reduction, which is public health language, not tobacco industry language, really, if you think about where it comes from, to launch e-cigarettes, or for instance, Philip Morris has a product called IQOS, which, are really distraction techniques. If you think about the fact that these companies still sell trillions of cigarettes a year around the world, that's where most of their money, the lion's share of their profits come from. And these products, when used as directed, kill half of their long-term users. So that's still going on. Um, I think also, what's happened is what I like to call the charm offensive, these massive PR programs and public opinion rebranding efforts that the industry is engaged in. And, those are not just targeted at, sort of framing a public health conversation, but it's also about shaping the broader culture. And for those to work, they need the help or to rely on, if you will, the platforms of others to get validation, to legitimize their efforts. So, we see things like media companies who have accepted advocacy ads from the industry. And these are companies that don't accept regular tobacco product advertising, or entertainment companies that include smoking and vaping imagery in their content, which has massive influence. Financial services companies, and I know we're going to talk about that later, who prop up the so-called environmental and social governance achievements, if you will, of these companies, or even the scientific community that allows the industry to present at their conferences or publish in their journals. And I think all of this is really important because everybody needs to be informed that they have a role to play in preventing the attempts of this industry to renormalize their products, to renormalize the industry itself, which is really in service of, finding a new generation of users for their products.
We've certainly seen that effort for the tobacco industry to represent themselves as just another credible business around the world. And I know you joined in a campaign we had a year or two ago called Quit Big Tobacco that reached out to businesses, especially ad agencies. And we heard that the tobacco industry is knocking on their door again, and they are trying to create new alliances to create campaigns to a new generation. We heard time and time again that businesses were being courted by industry representatives. What do you think are the most important tobacco industry strategies that businesses, partners, public health groups should be aware of and push back on?
Well, I'll talk about a few. First on my list always is the recruitment of young people to be the next generation of users. That's an evergreen strategy for the industry. When you think about it, 90% of tobacco users start before the age of 24. Nobody wakes up in the morning on their 40th birthday and decide, they're going to become a smoker or a vapor. That's because 1,300 people die each day in the United States of a tobacco-related disease. In fact, one tobacco industry executive famously said that, these young people are the replacement smokers to make up for those who, sadly succumb to a tobacco-related illness. E-cigarette companies also are using, very sophisticated and clever social media campaigns and influencer campaigns that appeal to young people. It's in the media that young people use. Kid appealing flavors is another one that, I think is really important to push back on. Menthol cigarettes, of course, they've always been a starter product for young smokers. Flavored little cigars, which a lot of people don't know, they look just like cigarettes, but they are wrapped in cigar paper wrapper. They come in grape and cherry and pina colada. And of course, e-cigarettes, which come in every flavor under the sun, including cotton candy and unicorn vomit, if you can believe that. And I think it's important to remember that, while the industry would like us to believe that, some of these novel products are really for adults, the fact is that only 3 to 4% of adults are using e-cigarettes, and that number has been flat for years. Whereas, as you said earlier, 20% of high school students are using e-cigarettes regularly. And many of these kids would never have used a tobacco product in the first place. The other thing I think we have to watch out for, and I mentioned this earlier, are these PR and advocacy campaigns that many of the tobacco companies are mounting. So, for instance, Philip Morris International, PMI, as they're called, launched a campaign, I think first in the UK, called Unsmoke the World. They launched it on New Year's Day and called it their New Year's resolution to end smoking, which is sort of ironic because if they wanted to end smoking, they could just simply stop selling and promoting Marlboro's, the number one cigarette in the world. But instead, what did they do on this day? Instead of not selling Marlboro's, they actually introduced a new combustible cigarette brand in Asia called Bold, which I have to say, I agree with them, is a pretty bold move to do on the day you announce you want to unsmoke the world. Or Juul is another one. In congressional testimony, it was revealed that they had tried to sponsor camp programs for underserved youth, that they tried to promote their products to church groups and tribal organizations. And even most recently, during COVID, as part of their PR efforts, one tobacco company offered to give free ventilators to hospitals, which is kind of ironic, knowing that smokers suffer and are vulnerable to much worse outcomes from COVID than non-smokers. And I guess the last thing I'd say is, the use of third parties to prop up the images of the industry. So, for instance, the Foundation for a Smoke-Free World is an organization that was created by Philip Morris. Initial funding, $80 million a year for 12 years, I believe. To this day is the sole funder. But Philip Morris is the sole funder of the Foundation for a Smoke-Free World. So they claim to be independent, but their only funder is a tobacco company. And what do? They publish industry-friendly research and fund industry-friendly research and PR. They've even funded a youth organization in California. So, that's just a partial list. And I know our panelists are going to talk a lot more about a lot of strategies that are being used to kind of distract us from what's really going on.
Thanks, Robin, for helping start peeling back the layers on this, this industry strategy. And certainly in our global work, Vital Strategies global work, we see a parallel story. This is a global story. It's not confined to just one country. As smokers are dying out and quitting in Western countries, the industry sees their growth in emerging markets, and they're using that same bottomless pocketbook and endless influence to deter and delay governments from strengthening sensible protections like bans on marketing to children. I'm eager to hear what our other speakers have to add to this conversation, to this topic of industry interference, and come back and spend a few more minutes with you reflecting on their take. So now we're turning to a conversation with Karen Evans Reeves, a senior researcher at the University of Bath and Stopping Tobacco Organizations and Products, STOP initiative, where Vital Strategies is also a partner. Welcome, Karen.
Thank you. Thank you for having me.
We started today's conversation by recognizing the changing face and strategies of the tobacco industry. Can you tell us what your research has revealed about trends in the industry?
Yeah, sure. So our research is showing that in light of decreasing cigarette sales and increasing regulation of tobacco products around the world, that the industry is really diversifying into new products, including e-cigarettes and heated tobacco products, in order to maximize their profits. So Philip Morris International, for example, has claimed that it wants to stop selling cigarettes and it wants smokers to switch to alternatives. And what it means by alternatives is preferably its IQOS, heated tobacco product. Yet at the same time that it's saying that it wants smokers to quit smoking, it's actually fighting back against regulation of smoking around the world, and also marketing its cigarettes still. For example, in terms of fighting back on regulations, menthol bans that are now coming in different places all over the world, the industry is pushing back against them. Why would you push back against a regulation if cigarettes are no longer important? So whilst we think that hearing a tobacco company saying that it wants to give up smoking may be radical, We've actually seen the tobacco industry try and promote harm reduction methods before. So ever since smoking was linked with lung cancer back in the 1950s, tobacco companies have been modifying their products in a tactical effort to stop governments from regulating them and to keep smokers smoking. And we saw this with cigarette filters, and then later followed by lower nicotine, lower tar cigarettes that we know as lights or milds. But misperceptions around these products still exist today. So filters still exist, even though they offer no health protection and cause massive environmental damage, with 4.5 trillion cigarette butts discarded into the environment every year. Following on from filters, tobacco companies have invested in smokeless tobacco products such as snus and e-cigarettes, but only once their core business is under threat. And so now, with its heated tobacco product, the industry is going all out to say that it wants smokers to switch. But global figures are showing that the overall nicotine market is increasing. So this suggests that there must be non-smokers taking up e-cigarettes or heated tobacco products like IQOS, or that there's a significant amount of dual use. So there's actually an additive effect going on now, rather than a decreasing in smoking levels. There's an additive effect going on with the amount of nicotine use.
Interesting. Thanks for putting some data forward that exposes the gulf between what the industry is saying and what they're actually doing. In the past few years, we've been hearing a lot about the Foundation for a Smoke-Free World. Can you fill our viewers in?
Sure. So for those that don't know about the foundation, Philip Morris International created it and launched it in 2017, pledging $1 billion over the next 12 years to, as they put it, put an end to smoking. And although its explicit aim has been to fund research into tobacco harm reduction, our research has actually found that the foundation is operating as little more than a public relations arm of Philip Morris International. So once again, this isn't something that's new. It's all happened before. It's a long-standing tobacco industry strategy to establish independent scientific organizations when it needs to show that its products are safe. In the past, those products were cigarettes, and now increasingly, these are heated tobacco products. A recent peer-reviewed paper led by my colleague, Tess Legg, has found several examples of the foundation and its grantees trying to get their research into scientific journals, whilst not being transparent about the foundation's links to Philip Morris International. We are seeing Philip Morris, for example, co-opting the same space as public health in order to become almost to occupy that space. So it's using the same language as public health would use in terms of saying things like smoke-free. It's holding science events. It's writing white papers. It's suggesting policy solutions and lobbying politicians with these solutions. I could go on and on and on and on about the things that they're doing. They're doing corporate social responsibility across the world, with particularly in light of COVID-19. They're providing lots of donations to different causes. And whilst obviously these donations are needed at this time, the irony is that the industry hooks users on products that lead to disproportionately worse COVID outcomes for smokers. So it's a bit like closing the stable door after the horse has bolted.
Karen, how can people act to counteract this charm offensive, and as Robin called it, and the tobacco industry's new messaging?
Yeah, so I think it's really important that policymakers exclude the tobacco industry and those who are funded or linked from policy discussions, because ultimately that's what the industry is trying to do. They're trying to get back into that space. I think advocates need to continue to hold the industry accountable. Journalists need to challenge the discrepancies between what companies are claiming and what they're actually doing. And universities and researchers need to reject working with both tobacco companies and those organizations which it's funding.
Karen, thanks for your time and expertise today.
Thank you.
We are now joined by Dr. Bronwyn King, founder, director, and CEO of Tobacco Free Portfolios. Welcome, Bronwyn.
It's a pleasure to be here.
Bronwyn, your work at Tobacco Free Portfolio examines how the finance sector can be a driver of the tobacco industry. How did you get started in this work? And can you share how you are working to get those who care about ESG factors environment, social, and governance factors to divest from the industry?
Look, it's a great question that's occupied most of my life over the past 10 years. I'm a cancer doctor, an oncologist by background. And 10 years ago, I found out completely by accident that my compulsory pension plan, my 401k, was investing my own money in big tobacco. So can you imagine that? A cancer doctor finding out that, in fact, at the same time as treating patients suffering from tobacco and really knowing what tobacco does to humanity, my own money was shoring up the industry at the same time. So I work, and my team at Tobacco Free Portfolios, we work with the finance sector to ask them to think again, and instead of investing in tobacco companies, instead of lending them money, and instead of insuring them, stand side by side with the global health sector, with governments, with parents, with communities around the world, and reject tobacco. It's really looking at the root cause of tobacco. It's one of those elements of tobacco that many people just don't realise, that they have a personal connection with the tobacco industry. And once people find out, we know that they really care about this. In the past 10 years, there's been a huge shift globally to tobacco-free finance. And that's where the finance sector rejects tobacco companies. It's full of a whole lot of different questions. You know, will you still make enough money is a great question. Some people think, gosh, I'd like to go tobacco free, but then is my 401k going to suffer? But in fact, we've got really good news there, that in fact going tobacco free in your investments is not just the right decision for health and for the environment and for the planet, it is in fact the right decision for your wallet. When CalPERS, the biggest US pension plan, went tobacco free, there was a lot of analysis over that. Was it a good financial decision? Early on, there were some questions, but now we have some really great answers. In December 2020, a report came out showing that CalPERS is $856 million better off since rejecting tobacco. And that has been repeated all around the world. So we've seen that with the Australian super fund, the biggest super fund in Australia, with the biggest pension plan in Europe called ABP. They're €700 million better off, and also one of the biggest Swedish pension plans. So we're seeing lots of evidence that tobacco-free finance makes sense for many, many different reasons.
That's inspiring work, Bronwyn. From Robin and Karen, we heard earlier about how the industry is working overtime to present itself as a good corporate citizen. Coming to sustainability, is that happening in the finance sector? Can you give us some specific examples about how the industry is presenting itself as, this great partner from an environment, social, and governance standpoint, particularly around sustainability?
Well, the big thing in finance is sustainable finance has just taken off, especially during the COVID crisis. People have realised that sustainable finance is the way to go. The problem is that we have seen big tobacco game the system of sustainable finance. There are more than 600 different rating systems out there that rank companies according to different criteria. And most of them use what they call a best of sector methodology. And by that, I mean they line up all of the tobacco companies, compare them only to tobacco companies. They all score very poorly, but the least worst one gets a gold star and ends up with this label of sustainable. So that is a problem in itself. We need those methodologies to change because best of sector doesn't make sense for tobacco. But in addition, tobacco companies have been hiring sustainable finance experts. They have contacted many of the signatories of our global initiative called the Pledge, the Tobacco Free Finance Pledge. So there's the $11 trillion signed up to that is looked after by 162 different big financial institutions worldwide. They've been contacted by different tobacco company representatives saying, actually, we're great. We do have all of these programs, for example, for getting more women on the board, getting more diverse representation, having childcare centres at our offices, having flexible workplaces, all of these things which individually sound great, but when you look at the big picture, these are still companies that make products that kill 8 million people every year. In addition, we've seen things like British American Tobacco launch their own ESG week, which is looking at their environmental, social and governance metrics, which is as absurd as it sounds. And then things like Philip Morris have launched a campaign called The World Is Not Our Ashtray, focusing on their environmental impact. Which is absurd given that cigarette filters are the number one ocean plastic and cigarette butts are the most littered item in the world. They also used the same image as the brand new Tobacco Free Portfolio's website for that campaign. So we know that we're on their radar, but we're certainly going to keep up our work.
Thank you, Bronwyn, for casting the spotlight on this specialized and important area of work in the finance sector.
It's a pleasure. Thank you.
And next, we are joined by Carol Magruder, founding member and co-chair, the African American Tobacco Leadership Council. Welcome, Carol.
Hi, it's a pleasure to be with you.
Carol, we've been talking about the tobacco industry's expertise in refashioning itself and their image to policymakers and in the finance sector. Can you add to this with your perspective on how this ability to target audiences shows up and what audiences are most impacted by these kinds of targeted campaigns?
Well, the tobacco industry, one of the things that they are really, really good at is segmenting population groups and really targeting messaging to them. So one of the groups that's been the most perniciously targeted, but certainly not the only one, is the African American community. And how that shows up in our community is the decades-long pernicious activity in terms of infiltrating our media, our magazines, bombarding our communities and retailers with the advertising on the stores. And even in the 60s and 70s of giving away free products to even children as young as 9 years old. So that's kind of the most, I feel, the most horrific targeting. But also they target the LGBTQ community. They were one of the first groups to really show gay people. And when you're marginalized like African Americans in the LGBTQ community, when you see yourself reflected, when you've been invisible and ignored, it's very powerful and actually more persuasive than in mainstream populations.
And over the years, have these tactics changed?
Well, the practice is, the more things change, the more they stay the same. So we're seeing so much in terms of the new practice, the new products that are out, but in terms of the tobacco industry's ability to racially profile us, and then because of our racially charged country right now with all of the different things that are happening with officer-involved shootings and police reforms, the industry has been able to very cynically onto their racialized profiling of us and flip that and try to block public health policy that would benefit African Americans, which would be removing mentholated tobacco products off of the market, and say that that's racist, when that it would help to save 45,000 Black lives that are lost every year in this country. In the past 20 years, that's 1 million Black people who have died from tobacco-induced diseases.
It's inspiring that your organization sees tobacco as a social justice issue and cites the industry's exploitation of the Black community with its long and documented history there. Carol, what have you seen in your research that shows how the industry goes about this? What are their tactics?
So the targeting that's been the most pernicious is latching on to culture, and actually there are people who say we now have a cultural affinity for tobacco products, and so that cultural affinity, quote unquote, is solely based on the predatory targeting of the tobacco industry on the African American community for decades.
And Black American adults have the highest percentage of menthol cigarette use compared to other racial and ethnic groups. Is that right?
That is correct. Over 85% of African American smokers who smoke a mentholated product. So we're not the only menthol smokers, but we have the highest by far prevalence of folks who are smokers who smoke, as well as our youth initiate with menthol as well.
And can you dig in a little bit more and help our audience understand about what menthol is and why it's so important?
Sure. So menthol is the mother lode of all flavors. There's a little bit of menthol in all cigarettes, but we have what we call characterizing, where there's a larger percentage of it. Menthol, it's an anesthetic, so it cools and numbs the throat. It makes the poison go down easier. It increases cell permeability in the lungs so that the toxins, the poisons, go deeper and stay longer in the lungs. And so we smoke less than others and we die more. We try to quit more and we're unsuccessful. It also it inhibits cessation as well.
Hopefully the FDA will take action to restrict menthol products. What happens next?
Well, one way is that we need to stop taking money from the industry, because when you take money from someone, you tend to dance to the tune that they play. So we are really working with all groups to take a stand and to not take this blood money. And that whatever the conversation is, whatever we decide to do as a society, the tobacco industry should not be involved in that conversation at all. They should not be at the table, whether as a voting member or a non-member, because they're allowed to participate in many of these high-level meetings. And they don't need to be there. And we should not be taking money from them, whether we're elected officials, community-based organizations, leadership organizations. We need to refuse that funding. So we really want to unify all of our organizations and all of our groups to stop the influence of the tobacco industry. And so we are joining together to pledge that we will no longer accept funding. And that's one of the things that people can do, is to stop the influence of these multinational companies. And you can find the pledge at thetruthinitiative.org/stop the influence.
Well, this is a good time for this conversation. The FDA has indicated it will take action on menthol, but that's clearly a protracted process.
Well, we would be very happy, but we know that is the beginning of the end of this journey. So there's a rulemaking process that it will take years before we actually see action. So we are hoping that they're going to do the right things, but either way, our movement continues and we must work even harder.
Thanks so much, Carol, for this insightful conversation, and to the African American Tobacco Control Leadership Council for their leadership on this issue in particular.
Thank you so much.
Now we'll bring Robin back into this conversation. Robin, I was really struck by the connecting thread of the stories of our panelists today. We're seeing a tobacco industry that's resurgent, that sees an opportunity to remake itself and is overtly co-opting the language and look of public health organizations. We often see industry mouthpieces talking about harm reduction, and Vital Strategies is fortunate to do some overdose prevention work. And I have to say that while I'm not an expert, I know that in harm reduction, it's in response to an illicit drug market where people are being harmed by unregulated supply. And harm reduction is there to support people and communities in protecting themselves. In tobacco control, that would mean actively seeking regulation, stopping all promotion or potentially even production of combustible cigarettes, and endorsing measures that reduce community harm, like smoke-free indoor air laws. We see the industry opposing all of that. What's worse is they've co-opted the harm reduction term, and that pollutes really thoughtful discussion of how harm reduction strategies could be applied to tobacco control. What's your take on this strategy?
We agree, Stephen. Harm reduction is a proven public health strategy. It works. That's why, for example, the FDA approved nicotine replacement therapy for smokers, which is a harm reduction strategy. And, potentially new products like e-cigarettes could play a role there as well. In a regulated industry, properly regulated industry, where marketing and promotion efforts by the industry are properly regulated and kept in check. But that's not what's happening today. Harm reduction is certainly not a strategy as being exploited by the industry, co-opting this idea and even suggesting sometimes that those of us in the advocacy space, in the nonprofit space, are not in favor of harm reduction, which couldn't be further from the truth. Really, this is all about the industry trying to remake their image and their products seem cool or even safe, which, we have to remember the science continues to find real health risks with these products, more and more research every day. And we don't know the long-term effects. In fact, what, you might say is going on is that we are all part of a long-term, real-time science experiment, being conducted by the industry on the population, a lot of it on kids. And, that we're the lab rats for this experiment. In fact, I often say that in many ways, there has been more research. We know more about the long-term effects of what's in a bag of potato chips than what we know about these products that are being inhaled into the lungs.
That's a frightening thought. We know we can make continued progress, and we heard today that we need constant vigilance. We can't take success in tobacco control for granted, and we need to adjust to the changing nature of the industry and to the tobacco epidemic as they continue to invest in and sustain their core business of cigarettes, the leading cause of preventable death around the world. What's the most urgent call to action you have for our audience today?
Well, first, I want to thank Karen and Bronwyn and Carol for everything they shared today. It's really important. I think, we have to understand the industry would like us to think that they've turned over a new leaf, that they're, all about harm reduction. But the truth is, they still depend on a business model that's actually about harm production. When you think about it from a public health perspective, environmental perspective, sustainability, governance, there is really, I think, no place at the table for an industry to be taken seriously as a partner or as a collaborator in solving a problem they created. And not only one they created, but one they continue to perpetuate every single day with trillions of cigarettes being sold around the world. What I would say is for businesses, organizations, institutions, individuals to reject this rhetoric from the industry. For example, for researchers and nonprofits to reject industry funding. Government and scientific organizations, don't let your conferences and your convenings and your publications become platforms for industry spin. Media companies reject all industry advertising, product advertising and advocacy advertising. For individual and large investors, rethink your portfolios and what you want your money to support. And then I would just say to everyone, please continue to follow the conversation, sign up for our Stop the Influence pledge, and, join us, because I do think together we really can create a future where tobacco and nicotine are things of the past. And today's conversation is a great part of that effort. So thank you.
Thanks, Robin, for pointing out there's something each of us can do to end the tobacco epidemic today. If you would like to learn more or sign up for the Stop the Influence Pledge, please visit truthinitiative.org/stop the influence. And I want to thank you again, Robin, and all of our speakers for this important conversation. And thanks to Truth Initiative for bringing us together today.